In a 2013 World Health Organization report, an organization of the United Nations focused on public health, they stated that 800,000 people each year commit suicide. If this was spread out evenly, that would be one person every 40 seconds. And in the speech, that would equal to about 9 people. The main killer of these people is not any mental illnesses they may have. It's the silence that surrounds them. The silence because they are afraid to ask for help and reach out to other people. The silence of other people as they don't check in on them and reach out to them. 1 in 5 adults in the United States has some sort of mental illness. These people are people you know, your friends, your family, your coworkers, or your classmates. We need to work together to end the stigma against mental illness, to make it okay for people to talk, to receive help, and to receive adequate care that they need. What stigma is a social hush. What this means is that people are encouraged to stay silent about their illnesses. If you talk about how you have depression or anxiety or other illnesses, it brings you shame. Whether we try to or not, unconsciously, we all affect people through stigma. We may tell jokes about it that can offend people. Also, we may say things like, you need to smile more, or why can't you just be happy, which really doesn't understand what their mental illness is. In 2016, the National Institute of Mental Health stated that 43% of people in the United States that had mental illness did not receive help. This left 25 million people without proper medication, therapy, or other treatments that could help improve their lives. One big factor for teens or adolescents is the amount of stress that they have in their lives. This is because of all the schoolwork they have, the extracurricular activities, the fact that they're still growing up and trying to develop individuality. This increases stress, which could make their mental health decline. Doctors are reluctant to give treatments to patients that will help them because they're afraid that the patients won't adhere to the treatment options. They'll stop taking the medication, or they'll stop going to therapy, and then they won't work, and that might reflect badly on the doctor. This is causing many problems for people with mental illnesses. They need help in different ways. In a study in Canada, as cited by Steffi Kanak in her article, Seeing is Believing, Biological Information May Reduce Mental Health Stigma Amongst Physicians, in 2015, they had doctors take a test, and the first few questions were on their opinions of mental health. Would they be comfortable going to a doctor or seeing a therapist? And for the ones who stated that they were not, they gave a patient less than adequate care. In this example, they had a man who had arthritis and back pain who needed pain relief. And some doctors that weren't okay with going to psychologists, getting treatment there, did not prescribe him this medication because he had schizophrenia, and they didn't trust that he wouldn't take too many at once or to stop it altogether. The solutions we need to end stigma against mental health involve 2 factors: education and attitude. We need to inform people about mental health and the realities of it. In an article by Patrick Corrigan titled Mental Health Stigma and Primary Healthcare Decisions in 2014, they use anti-stigma programs in Canada to help doctors understand the truth behind different mental illnesses and how treatments can actually be effective. They also cited biological sources for these illnesses, which helped explain what caused them. Another solution that we need to implement is a shift in cultural attitude. We need to shift away from having to hide how you feel and not admitting that you do need help or sometimes you need to talk to somebody. This attitude needs to be shifted by us. We need to go up to our friends and our family, our neighbors, and our coworkers, check in on them, make sure they're doing okay, and if you see symptoms of mental illness, just make sure they get the help that they need. And the biggest thing is we need to see people as people. Even if they have mental illnesses, they are people. We cannot see that first, because that can lead to discrimination against them, both for doctors prescribing medication and treatments, and in society, interacting with them. So, stigma against mental health is a big problem that hurts millions of people worldwide. And to end this, we need to educate people on the realities of mental illness and shift our cultural attitudes on mental illnesses. Throughout my speech, approximately 9 people have committed suicide. That is too many. These are friends, neighbors, coworkers, family members, too many people. So we need to end the silence, speak up, and help each other. Thank you.